Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. How long before Xolair starts working? Free serum IgE levels are decreased within an hour of Xolair administration. However, it may take several months for the full effects of Xolair to be seen, although some symptom improvement may be noted after a few weeks. Trials in people with allergic asthma noted significant improvements after 4 months, after 3 months in those with chronic urticaria, and after 16 to 20 weeks in those with IgE-mediated food allergies. Xolair is given every 2 to 4 weeks, and it can take approximately 7 to 8 days for peak concentrations to be reached after a single injection. Once discontinued, Xolair may persist in the body for 6 months to 1 year. Xolair, omalizumab, is an antibody that may be used to treat allergic asthma that is moderate to severe, persistent, not adequately controlled by inhaled corticosteroids. In adults and children aged 6 and over who have had a positive skin test to an allergen or who react to an allergen that is present in their environment year-round. Xolair is also approved to treat urticaria, hives, in adults and children aged 12 and older who have already tried antihistamines without success. Nasal polyps in adults aged 18 years and older. And to reduce the risk of allergic reactions, including anaphylaxis, in adults and children aged 1 year and older with IgE-mediated food allergies. Xolair is administered by injection under the skin, subcutaneously, once every 2 to 4 weeks. The dosage of Xolair is based on body weight. Xolair is absorbed slowly, with peak concentrations being reached approximately 7 to 8 days after administration. Although some improvement in symptoms may be noted after a few weeks, it may take several months for Xolair to start working properly in your body. Significant improvements have been noted in trials in asthma patients of 4 months, in trials of people with urticaria of 3 months, and in trials of people with IgE-mediated food allergies of 16 to 20 weeks. 68% of patients with IgE-mediated food allergies treated with Xolair for 16 to 20 weeks tolerated at least 600 mg of peanut protein, 2.5 peanuts or half a teaspoon of peanut butter, without moderate to severe allergic symptoms, compared to 5% of those treated with placebo, p less than 0.0001. In addition, 66% tolerated at least 1000 mg of protein from milk, versus 11%, p less than 0.0001, 67% egg, versus 0%, p less than 0.0001, and 42% cashew, versus 3%, p less than 0.0001, without moderate to severe allergic symptoms. This amount is equivalent to approximately 2 tablespoons of 1% milk, 1/4 of an egg or 3½ cashews. Xolair should be used in patients with IgE-mediated food allergies with continued food allergen avoidance. Related questions: what are the most common skin conditions? With photos, what are monoclonal antibodies? Is Xolair an immunosuppressant? How does Xolair work? Xolair works by inhibiting the binding of IgE to IgE receptors on mast cells and basophils. Mast cells and basophils are specific cells of the immune system that contain histamine and heparin. As soon as IgE binds to an IgE receptor, it causes the release of histamine and heparin from the cell. Histamine is a chemical that has many inflammatory effects in the body. It contracts the smooth muscle tissue in the lungs, uterus, and stomach, dilates blood vessels causing an increase in permeability and a lowering of blood pressure, stimulates the secretion of gastric acid in the stomach, and speeds up the heart rate. Histamine also causes symptoms such as a runny nose, watery eyes, tissue swelling, itchy skin, and hives. Because histamine contracts the breathing tubes, it can cause wheezing or make it harder to breathe. Histamine is also one of the main chemicals involved in anaphylaxis, a severe and often fatal allergic response to a previously encountered allergen. Heparin is an anticoagulant that slows the formation of blood clots. By inhibiting the binding of the IgE to the IgE receptor, Xolair prevents the release of histamine and heparin and also reduces the number of IgE receptors on basophils. Xolair forms stable Xolair/IgE complexes which are more slowly excreted from the body than free IgE. This means that total serum IgE levels, bound and unbound, will show an increase in laboratory testing. However, serum-free IgE levels are decreased within an hour of injection, and decreases of greater than 96% have been reported. IgE levels are increased in people with allergic asthma when they inhale allergens such as beta-dander or dust mites, which is why Xolair is effective at treating allergic asthma. Xolair will not treat an acute asthma attack or status asthmaticus. 93% of people with moderate to severe chronic urticaria have increased total IgE levels. IgE levels are also increased in people with IgE-mediated food allergies when they come into contact with a food allergen. RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.